Okay, well, we like to talk about the positives, right? Doctors want to talk about the positives. You know, just a minute ago we were asking about death and complications and things like that, and those are terrible, and we need to talk about those things, so you're right to ask about them, but we much prefer to talk about the positives. And so, like, ask me about diabetes.
I have diabetes too. That's my next question.
I love you. Yeah, you know, diabetes, there's a shot, and we can go into details about it if you want. It's really interesting, new research, and talk about the mice from France that they did the Roux-en-Y on, and it's just really interesting. But there are a lot of us now who I think we feel pretty comfortable saying we have a shot at curing your diabetes, which is a really big deal, and you just can't say enough about that. But and again, with a relatively safe and short and simple surgery, I mean, it's a big deal. So, but what about your question? I don't want to skip away from it. You ask a really good question. You say, well, Dr. Rutledge, you're talking about this bile and this stuff and ulcers. I have reflux. I have gastroesophageal reflux disease. Have they said that to you? They've given you the abbreviation GERD. Well, GERD, as you may know, is really common. It's so common that the prescriptions for the purple pill you see advertised on TV, and you may have seen that Prevacid is now out as a new over-the-counter drug, and you see in the grocery store Prilosec and the generic version omeprazole. Those are some of the top prescribed drugs in the entire world because GERD, or your reflux, with or without a hiatal hernia, is an extremely common problem in the United States. And in fact, many of the cancers that we have in the United States are declining. So lung cancer is going down, things like that. But esophageal cancer, along with reflux, is one of the few cancers in the United States actually going up. Okay. Now, you remember the packet. Okay. One of the things we ask in our packet is we say to you, do you have reflux, and are you taking medicine for gastroesophageal reflux disease? Preoperatively, 2/3 of our patients have gastroesophageal reflux disease. Now, we also ask you after surgery to fill out a form, and we track that information. And 85% of people get better from their reflux. Now, let's see if we can explain why. I don't have my little drawing chart here, so when we talk about gastroesophageal reflux disease, there's a G in there, right? G is the gastric acid that's refluxing, correct? And you treat it, what did the doctor give you to treat your gastroesophageal reflux disease?
I have Prilosec, the other P one.
Prevacid?
Prevacid.
Right. So he gave you, those are called powerful antacids. Okay? And that's because the acid in your stomach is refluxing back up into your esophagus. And so I want to point out that G in GERD because of the gastric acid. And I would like to remind you, what is the surgery you're going to have? It's a mini. And what does it do to the gastric? It bypasses, it cuts the stomach and cuts the vagus nerve. So what would you guess happens to gastric acid? It goes way down. Yeah. The second thing you mentioned is the fact that you have this hiatal hernia. Okay. Do we know what hernia means? You know how we give the name hernia? It means it's something in one place goes to some place it's not. So like if you have an inguinal hernia, it means your gut pops out into your skin where it shouldn't be. It makes a bulge. A hiatal hernia means that God separated the abdomen from the chest with a sheet of muscle called the diaphragm. And he made tiny little punctures to let the esophagus and the aorta and things through. So there's a spot for the esophagus to come through. But in heavy people, where there's more pressure, oftentimes the pressure of the stomach will start to push and punch on that space where the esophagus comes through, and the stomach will begin to herniate up into the chest. Okay, now normally God has a very powerful, very well coordinated sphincter, so that when you swallow, food goes down, the valve that lets food go into the stomach with great coordination opens, lets the food in, and then slams shut so acid doesn't come back up. But if the stomach herniates up into the chest with the negative pressure and the positive pressure from below, it sometimes pops open and pushes acid up in there. So wouldn't it be nice if we could grab a hold of the stomach, maybe anchor it to something and pull it down into the abdomen? That would make that sphincter work better. And in fact, that's what we do. We make a long stomach and we attach it to the intestine, which lives in the lower part of the gut, and it hangs down. So it's what we call reduces the hernia.
So that will happen?
Yeah. Because what I'm doing now is trying to explain why people get better with their reflux after the MGB. So number one, we cut the stomach and cut the acid nerve to the stomach. 2, we hang the bowel off of it and pull it down. 3 is obesity is associated with, hey, trouble!
I'm so sorry.
No, that's okay. Good, how you doing?
Good.
All right, good, welcome. Number 3 is that because obesity causes that, as we make you thinner, oftentimes the GERD gets better also. So that's 3 things. And then number 4 is when we staple next to the sphincter, that valve, it tightens it and makes it more powerful and less floppy. So for all those reasons, we hope and pray and expect your GERD should get better along with your diabetes. Can we, I'll stop that right there.